Thank you all for being here today and for inviting the Pancreatic Cancer Action Network to share information about our organization. We are often referred to as PanCan, and our vision is to create a world in which all patients with pancreatic cancer will thrive. We like to say we have a comprehensive approach and are tackling this disease from every angle, advancing research, empowering patients through our patient services program, and building community. From a research perspective, we both fund research in institutions across the country, as well as do our own research because we know there are opportunities to accelerate what the community is already doing. When PanCan was founded in 1999, there were only a handful of scientists studying pancreatic cancer. Really pleased to share that today there is a vibrant and robust scientific community, and PanCan has funded 217 scientists at 78 institutions across the country. And as I mentioned, we're doing our own clinical trials like Precision Promise to find better treatment options for patients, an early detection initiative. And I want to maybe highlight for just a second our Spark Health Data platform. We are collecting, with patient permission, a tremendous amount of patient data through all of our research studies. And we are really thrilled to be able to make that data available to scientists across the country. Quickly, would also like to just highlight that our Know Your Tumor precision medicine program really led the way to genetic testing and biomarker testing becoming standard of care for every pancreatic cancer patient. Another way that we advance research is through government affairs and advocacy. As you can see, when our organization was founded in 1999, pancreatic cancer received just $17.3 million from the National Cancer Institute. In 2021, which is the latest information we have from the NCI, pancreatic cancer research received over $203 million. And in addition, PanCan and our amazing grassroots community worked with the Department of Defense and Congress to get a standalone pancreatic cancer research program funded through the Department of Defense. And last year, that program received an additional $15 million in funding. Of course, as you probably all know, a lot of this federal research funding is at risk. There have been executive orders and actions that are threatening the amazing progress that federally funded research is making. And all of this, of course, threatens progress for pancreatic cancer patients today as well as tomorrow. There's a lot of uncertainty as to what's to come and what the realities will be for federal research funding, but unfortunately, Congress has completed their work on the fiscal year 25 budget, and it included significant cuts to cancer research, including specifically zeroing out the pancreatic cancer research program at the Department of Defense that our advocates had worked so hard to create in the first place. The good news, or maybe not the good news, but the hopeful news is that there is now work being done on fiscal year 26. And so members of Congress are signing the Dear Colleague letter, really advocating for increased federal research funding for pancreatic cancer. So we encourage you all to go to pancan.org/advocacy to learn more and to take action today. Now I want to highlight as well a little bit about our patient services program. It is really a world-class program, having provided service to more than 250,000 individuals since the organization's founding. Our first job through this helpline is to respond to the caller's needs and questions. Sometimes it's a 911 phone call, but oftentimes somebody is calling and they don't even know what questions to ask. Our case managers are highly trained, staying on top of the very latest in the field, and can answer any question that any patient, caregiver, or healthcare professional might have. And our motto is that if we don't have the answers or resource to support that question in this moment, we will get those answers within 24 hours. In addition, our case managers connect to the same individual time and again so that when an individual calls back, they're connected to the same person and don't have to restart their story. Finally, our case managers are also trained to, once they've addressed the caller's primary needs and questions, to really pivot that conversation into a conversation about the importance of seeing the right team, getting the right tests, and getting the right treatments. Those are three things that are true of any type of cancer patient. And so we have the resources through our patient services program to support those decisions that patients will have to make. Where should they be seen for their care? Let's make sure you get genetic and biomarker testing to get the most accurate diagnosis, which then leads us to being able to help support them making their very best treatment decision, which often might be a clinical trial or a targeted therapy. This slide just shares information. We really encourage every single one of you to call or email our patient services team, because no matter where you are in your journey, or even if you're just worried about your risk of pancreatic cancer, we can help. I want to close with just sharing some information about PanCan's impact in the state of New York and with NYU specifically. PanCan has provided services through our patient services program more than 5,000 times in the state of New York in the last year. We have referred more than 230 individuals specifically to NYU in the last year. We know how important it is for patients to see doctors who see a high volume of pancreatic cancer patients, so we can help refer individuals to various institutions like NYU in the state of New York. And we have referred over 1,100 clinical trials. We have referred patients more than 1,100 times to clinical trials here specifically at NYU. Throughout the state of New York, we have funded more than $10 million in research to 30 grantees across the state. And then specifically here at NYU, we have funded about $1.5 million. So we really invite you all to join our community, to join our movement. On the screen are three ways you can get involved. Call our patient services helpline at 866-458-3286. Visit our website, pancan.org, for more information, or to click on the Get Involved section to get involved locally. And again, encourage everyone to go to pancan.org/advocacy to take action today to protect federal research funding. Thank you all so very much for your time and energy, and I hope you will visit our website and reach out for more. Take care.
The National Pancreas Foundation. So the National Pancreas Foundation provides hope for those suffering from pancreatitis and pancreatic cancer through funding cutting-edge research, advocating for new and better therapies, and providing support for and education for patients, caregivers, and healthcare professionals. Here's some of the impact from the National Pancreas Foundation.
Good morning. I am Karen Martin with the Nikki Mitchell Foundation. I'm the event administrative and patient coordinator. Nikki Mitchell Foundation is a small but mighty pancreatic cancer foundation out of Nashville, Tennessee. NMF is committed to research, and we fund research and grants every year. But today we would like to focus on what NMF does directly for patients and their families. I became a volunteer in 2015 before NMF had a patient, when all we had was some money raised from a couple of small concerts and a sense of urgency to fulfill Nikki and Mitchell's goal to assist pancreatic cancer patients. Nikki Mitchell was a pilot, an adventurer, an animal lover, and the right hand of country music artist Waylon Jennings, and served as the president of his company for 22 years. She was also a patient of Dr. Wolfgang's. The seed for our foundation was planted during Nikki's treatment journey when she found fellow patients were having to skip treatments because they didn't always have the ability to get to them. Before her passing, she enlisted the help of her best friend and care partner, Rhonda Miles, to fulfill this need, that no patient would miss treatment because they didn't have gas money to get there. NMF started small with just Rhonda, a part-time administrative assistant, and a small group of determined volunteers, just sending out gas cards to patients that a local oncology center referred to us. I remember when Rhonda held up the first package of gas cards in NMF sleeves and said that we had patients to send them to. We all cried. This became our first formal patient program, Bridge of Wings. It didn't take long to find out that patient needs were more than gas cards, and Bridge of Wings expanded to assist with other expenses. Next, we launched one-on-one support phone calls. During my time as a volunteer, I contacted patients and checked in to see how we could help fulfill their needs. I was exposed to the challenges of the pancreatic cancer world with every call. This world, the medical world, your world, is overwhelming, confusing, and utterly scary to us. Doctors and nurses are used to it, but patients, their families, and caregivers are not. This is ultimately what became the inspiration to create a space where patients and families could take any need and have it met. The Center for Patient and Care Partner Engagement was launched in 2022 and offers financial, emotional, and social support through our many programs. When you are thrown into it with a cancer diagnosis, your body goes into fight or flight mode. You have the singular goal of survival and will do anything to achieve that goal. You Google current scientific treatments, current successful treatments, holistic cures, herbs, tinctures, combination of science and home remedy, and you don't limit it to local areas. These days, people want to have more say in their treatment, and with the invention of the internet, have more avenues to acquire this information, which sometimes can lead to confusion. We at Nikki Mitchell Foundation believe that the key to a patient's success is, from day one, building a team, just like a football team, a team that can help run plays, gain yardage, and cross the goal line. In the medical world, they may call this multidisciplinary teams, NDTs, and studies have shown that it improves the quality of life for patients. Cancer forces you to ask for help, and for some that is difficult. So why not immediately start with help on day one without being asked? Having a team is a game changer. Now let's imagine this team. Now, just for the record, we are using Georgia because we're from the South. So don't.
I would have used the Giants.
You know, we're college football people down there. So let's imagine this team. The doctor, your coach, is busy working on the game plan for each week and reviewing things for tendencies, strengths, and weaknesses. He works with the assistant coaches, your other doctors, oncologists, gastro, radiologists, to discuss and prepare for each week. For some of you, this may be Dr. Wolfgang. You can see he is suited up and ready for the challenge. Palliative care, supportive medicine doctor. That's your tight end. who serves as the receiver of the patient's information and blocks potential issues coming down the line. Pain, anxiety, fear, and stress. Nikki Mitchell Foundation is a huge advocate for putting a palliative care doctor on the team immediately. Consider them a supportive medicine doctor because there can be a stigma with the name palliative. You must understand that this is not hospice, it's quality of life. The patient, the quarterback. The patient is the leader of the team who receives the ball and runs with it, runs each play as if their life depends on it, because it does. The nurse navigator, nurses, they're the centers. They snap the ball to the quarterback, but they handle the ball on every play. They are the constant for patients and sometimes can pick up on issues first. We depend on the nurses. The caregiver, that's a fullback. The fullback always protects the quarterback. That's their job. They are bigger than life. Resource organizations, the left and right guards. Their job is to block for and protect the quarterback and ball carriers. Our ambassador programs, the Nancy Lyle Prehab program and Thrive Together, they're the cheerleaders, supporting, building team spirit, cheering them on with each play, whether the patient gains yardage or if they get tackled downfield. The ambassadors are the ones who support, encourage, share experiences, and prop the patient up when they feel like falling. Their support, along with outside support, builds the patient's outer pride, while our ambassadors' encouragement of self-care promotes inner pride. What is this program? Nikki was known to say, "It really helps when I can talk to someone who is going through this." 7 years after the foundation was created, Dr. Andrew Page came into the picture. Dr. Page, a surgeon at Piedmont, Atlanta, had a very special pancreas cancer patient named Nancy Lyle, who knew the power of peer support. She loved Dr. Page and his team, but as a patient, she needed more. She desired peers to talk to. So Nancy started reaching out to others and giving them what she knew she needed. Support in the same way that NMF was providing one-on-one support. When Nancy heard about NMF, she felt the partnership was perfect for her vision, and the Nancy Lyle Ambassador Program, what we call NLAP, was started. Even though we lost Nancy soon afterwards, she knew Dr. Page and NMF would carry the ball across the goal line for her. The ambassador programs are virtual group sessions that take place over Zoom, aimed at supporting patients with pancreas cancer, pancreatic disease, and their care partners. It is designed to enhance treatment through targeted education and peer support. Our goal is to supplement critical gaps in healthcare delivery by providing accessible and compassionate peer support to all patients and their care partners. We have 2 ambassador programs. The Nancy Lyle Prehab program is associated with a clinical program that has partnered with us to create a program specific to their surgical patients. 1 week out of the month, non-physician clinical team members host the meeting. Patients have an uninterrupted hour with the clinicians for questions and concerns. We also have twice monthly sessions in our second program, Thrive Together, which includes patients and caregivers from all across the country and all at any stage in the disease. Patient and caregiver ambassadors share nutrition tips, symptoms, how they use Creon, bowel issues, family support or lack of, stressors, their experience, and much more. Our clinical partners tell us they feel the patients and family members who attend the ambassador programs are more informed and confident and have fewer questions on rounds. Ambassadors are chosen with qualities like compassion, ability to listen intently, commitment, trustworthiness, respectfulness, and diversity. We have a lead ambassador here, 11-year pancreas cancer survivor, patient of Dr. Wolfgang, and founder of patient support program, Hope Sweet Hope, Lisa Eidelberg, to share more about the ambassador programs.
Hi, everybody. As Karen said, I am Lisa Eidelberg, and I am not only a board member on the Nikki Mitchell Foundation and a volunteer, but an 11-year pancreatic cancer survivor. Thanks to this wonderful gentleman down here. I can tell you from my own experience how critical programs like those offered by the Center for Patient and Care Partner Engagement are to patients and their families. In 2014, like probably many of you, I woke up yellow and not knowing why, 2 days later, I was diagnosed with pancreatic cancer. I was 53 years old, otherwise healthy, a full-time working mom of twin 19-year-old boys. One of them is here today. I was shocked. I had no family history of pancreatic cancer, nor any cancer that we knew of. To say we were scared was an understatement. As a mom, my fear went right to my children because they were too old to deal with it, yet too young to have to. 2 days later, I was meeting with Dr. Chris Wolfgang down in Baltimore at Johns Hopkins Hospital to see if I was eligible for something they were saying was a Whipple surgery. The only thing I knew about Whipple was in a toilet paper commercial at that time. Days later, I did have that Whipple in Baltimore. My husband and children stayed in a hotel for 9 nights and were eating every meal out. Post-Whipple, I endured the intense chemo that Dr. Oberstein spoke of, the FOLFIRINOX, and kept that off with radiation. Thankfully, I am here 11 years later to tell you my story. However, I was an island unto myself. Nobody else knew what I was going through. Yeah, my family and friends were amazing. They did great. But at the end of the day, they couldn't comprehend the lack of appetite, especially since I was a huge eater, the repulsive smells, the bowel issues, neuropathy, the extreme exhaustion, or the feeling of guilt that I carried that I was causing angst to so many around me. This is exactly why Nikki Mitchell Foundation and the Andrew Page Pancreas Cancer Fund came together to start these ambassador programs. So I can attest to you as a patient, these programs are critical. They're critical to the emotional well-being and those navigating the pancreas journey. Every week, whether through Nancy Lyle Ambassador Program or Thrive Together, we watch new patients come on, and it's amazing to watch them. They come on, they're scared, they're angry, they're just simply crying and just want to remain quiet. After the hour, we see their shoulders relax. They start to laugh. They enjoy these sessions so much, even though we're talking about pancreas cancer. Why? Because we've walked their shoes. All of a sudden, these pains and appetite issues and bowel issues they have become somewhat normalized because they hear it from other long-term survivors or other patients that are diagnosed. And really, until you've gone through somebody else's journey, you can sympathize, but you cannot empathize the way we do during these sessions. The ambassador programs truly fill a gap that exists in a cancer journey. No matter how wonderful your clinical team is, and believe me, the team here is phenomenal, but no matter how fabulous your clinical team is, there is no substitute for the support that comes from patients and caregivers who have been through it themselves. Partnering with clinical programs across the country has allowed NMF and the Andrew Page Pancreas Cancer Fund to meet that need. The other critical area of helping some patients is through financial support programs, which is a huge part of what NMF provides. Just a brief story about how I became associated with them, and I will keep it brief because I see that time clock going. But my surgeon, Dr. Chris Wolfgang, and his PA, who we referred to earlier, Lindsay Manos, had been trying to fix me up for over a year with somebody named Rhonda Miles. Rhonda Miles was Nikki Mitchell's best friend and the founder of the organization. But sadly, Nikki had lost her battle. And I was trying to keep my blinders on, stay positive, keep the journey just to survive our stories. I finally agreed to meet Rhonda, and I was struck by her commitment and compassion to help patients. And I knew immediately I wanted to be a part of NMF. As a lucky survivor, I wanted to pay it forward, and Nikki Mitchell was the perfect fit for my goals and offered me multiple ways to get involved. A couple of years after that, I was having just an innocent conversation with a patient. His name was David Sokoloff. David had to do trials down in up in Johns Hopkins Hospital. He lived in Florida, but through a grant program, he had free airline tickets to get to and from treatment every time he needed to go with a care partner, but his hotel bills were thousands a month. It was then that I realized there was such a gap and need for patients to simply just get them to treatment. Forget about insurance or how they're going to pay for the treatments. Many patients cannot afford to seek the best medical help in the country or world. So they're forced to seek help at local hospitals where perhaps they're not as familiar with the intricacies of pancreatic cancer and all that comes with it. It was then that Hope Sweet Hope was created, all through an organic conversation. Hope Sweet Hope is a fund overseen by the Nikki Mitchell Foundation that provides lodging and transportation to families in need of world-class treatment. Our goal is to give every patient equal access and opportunity to the finest care, regardless of their financial situation, and help reduce their stressors. Since its inception, Hope Sweet Hope has sent numerous patients to institutions across the country and give them their best hope for survival. We've helped people from the US, as well as Europe and Canada, get to surgery, trial, or treatment that fits their needs best. Our goal is to continue to work in tandem with Nikki Mitchell Foundation to help reduce the financial stress of pancreatic cancer so that patients and their care partners can focus on one thing, their health and their survival. For me, the most important thing about the Nikki Mitchell Foundation was that they were open to supporting Hope Sweet Hope without any administrative fees. This means 100% of the money raised goes to the patients directly. I'm going to say that again. 100% of the money goes to the patients directly, for which I personally approve. As a reference, not every organization does this, but Nikki Mitchell does, and they also took on the responsibility of the administrative fees as well. As most of you know, pancreas cancer doesn't just impact the patient, but the family and community as well. I mean, just one quick little thing. Yes, I had pancreas cancer, but the trauma of my diagnosis sunk my mom from mild/moderate Alzheimer's to severe Alzheimer's within the 10 days of my treatment. So that was something else that I then had to take on in addition to. So the Center for Patient and Care Partner Engagement, which includes financial and peer support programs, is really, really critical to many patients and families, as these programs bridge the gap between clinical and financial and emotional well-being. Each of us faces all these aspects to varying degrees during our journey while we're dealing with cancer. Everyone in this room or at home has sought care from the best physicians. And again, I had the best physicians, and that's why you're here. By assisting and supporting patients and families with financial and emotional support, the Nikki Mitchell Foundation not only supports patients, but it also supports the clinical teams that work so hard to take care of us. I was fortunate that I was able to seek the best treatment without any care to financial stress. But we must help as many patients as possible to give them their best hope and their best shot at thriving and surviving. And we hope you will join us. Thank you very much.
Okay, in 1996, Ron and created for fundraising. This 200 inaugural Ronald Hurtis Chair Basic Science named and seed grant is founded, mission statement formed. Basically, 2 weeks after Ronnie passed, I went to UCLA to meet with the doctors and decide how I can help with their research. And at that particular time, they said that they don't really have one. So I said, now you have one. This is our 29th year with the Hirschberg Foundation fighting for the cure. Okay. The early days was pancreatic cancer, to create the Pancreatic Cancer Center where all the needs of pancreatic cancer patients can be met. To be recognized as a patient support reference source for pancreatic cancer patients, for projects and programs designed to improve patient care, treatment, ultimately pancreatic cancer survival rates, to integrate and unite generations, young and old, through physical fitness, participation, while creating public awareness and raising money to find a cure for cancer. To create a premier pancreatic cancer center where all needs of pancreatic cancer patients can be met in one location with the most advanced treatment options. And these are the two gentlemen that helped me through my career for 29 years learning science. We have a new center at UCLA. It opened in 2022, 800 square feet. There are 23 patient rooms, support services, surgery, medical oncology, radiation oncology, gastroenterology, palliative care, psychosocial support, nutrition, clinical trials, and we do have a patient navigator. The second pillar is to fund projects and programs designed to improve patient care, treatment, and ultimately pancreatic cancer survival rates.
Yeah, hi, everyone. I'm Mikko Sehintat. I'm a professor at UCLA, and I work closely with the Hirschberg Foundation, helping them to manage their seed grant program. And the seed grant program is extremely popular, and we celebrate this year the 20th anniversary of this program. We have almost 100 applicants each year, and we try to fund as many as we can. And I'm proud to say that we funded NYU on multiple occasions. Tamás Gonda got at least 2 grants from us, and Chris Wolfgang also was a previous grant recipient. And as you heard, that federal funding is being cut, at least this year, for pancreatic research. So private foundations and funding through private foundations are extremely important to advance pancreatic cancer research. And we also have sort of a scientific mini symposium in the fall. And this year will be particularly exciting because this is the 20th anniversary of the seed grant program. And we will have sort of a celebratory scientific symposium, which is more geared towards scientists and not so much for patients. And again, the patient program is very important. Our patient symposium is usually in April or March, and we just had it very recently. And Aggie went through some of this already. And then once a year we go and run, and that's our awareness program. And this is a very nice event on UCLA campus, because in October the weather is great in Southern California, and then the turnout is always fantastic. And I'll thank you for your attention one more time. And I guess if you travel in person, you have this privilege, you can present twice. And then thanks again for the organizers for inviting us.
There are a bunch of questions online, which I'm going to start with very quickly. And actually, some of this is very much related to the nutritional and the GI component, which all of you have mentioned how difficult that is in terms of recovery and in this disease. What are the best meal plans for patients with both pancreatic cancer and diabetes?
My name's Rebecca Gutterman. I'm a registered dietitian. I'm also a board certified specialist in oncology nutrition. So I work very closely with people individualizing nutrition care plans. So a bit of a difficult question to answer broadly because everything we do really is personalized and individualized. The best meal plan is going to be the one that works for that individual person. It does often include smaller and more frequent meals, foods that are going to be easily digestible, depending on if they've recently gone through surgery and are recovering. For the diabetes component, foods that are higher in complex carbohydrates to keep the blood sugar a little more controlled while still thinking about the ease of digestibility of those foods. I always encourage a lot of protein-rich foods for strength and healing and really supporting the person going through the treatment dependent on where they are in that journey.
Thank you. And this is an important question that I think I'm going to target to Danielle, but it is it's a difficult question, and I think something that probably is on the mind of a lot of patients who are newly diagnosed with pancreatic cancer. Can I get help creating an advance directive or living will after a pancreatic cancer diagnosis, and where do I turn for help for that?
Hi, once again, my name is Danielle Smith. I'm a licensed clinical social worker. I work with the GI team. That is a really good question. So usually when it's directives and things like that, we can kind of assist with a healthcare proxy form. But anything kind of more advanced, we sometimes refer to our free legal clinic, which is New York Legal Assistance Group. And sometimes they'll be able to kind of guide them and direct them to help with like a will or directives, advanced directives.
And a little bit along the same lines, what financial grants are available specifically for pancreatic cancer patients?
Well, that's a great question because just being here today, I didn't even know about all the organizations that actually specifically have pancreatic cancer grants. But usually from the top of my head, we usually refer to New York Cancer Foundation. They're pretty broad. And they're able to provide maybe like a month worth of rent and things like that. And we also refer them to Cancer Care because they also provide transportation grants and some financial grants. So those are just the top of my head, some of the grants that we refer to. But now being here, I will definitely be reaching out so I can refer them to these organizations as well.
Sounds like the conference is achieving its goal.
Yeah, I was like, this is great.
Yes, we're all learning.
May I ask a question? So this is specifically to Lisa Eidelberg. So obviously you've gone through this yourself and you've continued to be involved in now helping other patients sort of negotiate the whole treatment cycle. And in terms of sort of like patient-centered satisfaction type things, what are we as clinicians, what do we need to improve upon? Where are we still failing in doing, making the experience better for our patients?
So what we're hearing from during many of these ambassador training programs that we do is that they're told the procedures, what's going to happen. Maybe they're given one person to speak to, but they really don't have that feeling that somebody is understanding them. So now what's happening is they're constantly calling the clinician's office because of the pain or something's unusual, where they can now turn to us and have their questions answered by somebody who has gone through it. In addition to that, we offer a prehab session once a month. So it is taught by the clinical team on our sessions, and they really do get to learn what is going to happen to them, what are some of the after effects they may feel, and where they can turn to should they need to talk to somebody. And that is important because it also takes a lot of the weight off of the clinical team.
If you were charged with designing the perfect system, say you had unlimited budget, what would that look like? And, you know, scale it up so that everybody would have access to this.
Wow. Well, in addition to the programs that Karen and I spoke about today, it would be a well-rounded patient and care partner center. That would be the finest clinicians, nutritionists, social work. I mean, that's really important because it takes a ginormous emotional toll on the patient and those around them, and it is critical. It would also entail education. And if I had to say something, and Karen, please, if you have something else to add, please do, it would be to have people who have gone through this to be as part of that team, because they are the ones that really understand this. Anything else you can think of to add?
Yeah, on our calls, our weekly calls, we do have ambassadors, as well as the patient caregivers. Some of our ambassadors are the caregivers. So we always have a patient and a caregiver on the calls. And I think that's really important because the caregivers don't always have someone to talk to. And when the patient is at an appointment, all of the focus is on what they need to do for the patient. So providing support with the caregivers is so critical also.
Thank you for that.
Actually, one of the questions kind of links very well to this, and I would ask for both of the foundations if you have specific responses about this. What emotional support resources are best that are available online, both during the journey of pancreatic cancer and to some extent also to the families of patients with cancer?
My favorite event is in my backyard in Los Angeles. Generally be every summer, always in August. A proclamation is about 40 patients, all stage of cancer. So I take the 22-year survivor to the one that's about to have the surgery in a week. They meet, and that the whole point of the garden and the food and is to just inspire that there are 30-year survivors as well, okay, as well as the newbies. So it's tearful.
And I'd like to add to that as well, which is fantastic. I mean, I think that's so important. Our Nancy Lyle Ambassador Program also provides that. These are patients that are about to go into surgery, and it offers them perspective from patients who have already been through it. And alternatively, our Thrive Together is just general pancreas disease. And again, very important for patients to speak to someone because that gives them peace of mind. The minute you say, I'm a long-term survivor, they relax.
I also wanted to include that NYU also has online caregiver support group as well. So that is something that's also available for our patients. And we also have mental health services, which are for, we have a psychologist and a psychiatrist. So that is also available for our patients as well.
A few more questions returning to sort of nutrition issues and appetite issues in particular. What you recommend for patients dealing with post-operatively or during chemotherapy, lack of appetite, what your thoughts are about appetite stimulants and altering diet in that context?
Yes, so definitely a very common and difficult problem to deal with, to manage. Poor appetite, I usually try to dig a little bit deeper and see if the patient is having any other symptoms that are really leading to that poor appetite. What's making it hard for them to eat? What other nutrition impacting symptoms are they having, such as nausea, such as diarrhea? Being in the bathroom many times a day could certainly decrease your appetite and your desire or willingness to eat. So trying to dig a little bit deeper as to that root cause of the poor appetite is my strategy in assessing the person and where they are now. In terms of managing that with appetite stimulants, it's a bit individualized. Again, it depends on if there's a symptom causing that poor appetite, we could manage those specific symptoms with certain medications. The appetite stimulating medications I've seen mixed results with on just an anecdotal basis for people I've worked with. So it's certainly a discussion. If there are no concrete nutrition impact symptoms reducing that appetite, that's usually when I see the appetite stimulant medications working the best.
And then I think this is perhaps the last set of questions which surround the question of online forums and navigator programs, and perhaps all of you can comment a little bit. One of the questions is what online forums are safest and best for pancreatic cancer patients, and the other one is really about how to find a navigator person. I can mention that that's something that we are integrating into our program here at NYU, but I think especially for patients in other places and other programs in general, how do you find a navigator? How do you find the right online forum? Which ones are the safest?
So with our Thrive Together program, it is open to anyone, anywhere that is going through any pancreas disease. So we will sign them up and send them reminders with a link on it prior to the meeting. And they can go on camera, stay off camera, they can listen, they can participate. So they can just kind of try it out and see if it's a good fit for them. Every week is different depending on who the ambassadors are and what our patients are going through. But we do spend a lot of time on the day-to-day things that the patients are dealing with. Lisa talks a lot about Creon. Rhonda is a huge palliative care advocate. But they learn just from day-to-day things about like hernia belts. And I don't even know if that's the proper term, and the use of Creon, and like even something as simple as taking a pillow with them to the hospital to hold against their stomach after surgery. So I think anybody who's looking for extra support, it can't hurt to reach out and try these calls. And we are definitely open to having new people come on. And again, they can participate, they can hang out in the background and just see what's going on. And we welcome that, and they can just reach out to us. There's also a sign-up sheet out there, but we're glad to help and have anybody log on.
And for our Nancy Lyle Ambassador Program through Piedmont Hospital, when a patient goes in, they can opt out. Otherwise, they are referred to the program through the hospital.
Yeah, it is very surprising because people, they usually enroll the patients, Piedmont does, about 8 to 10 weeks before their surgery. So they usually go through 2 clinical prehab sessions, as well as the normal weekly sessions with the caregivers and the ambassadors who've already gone through the surgeries. So it's a huge help to help them prepare for the surgery and what to expect afterward. And then after their surgery, they're usually on the call for about another 4 to 6 weeks. And then we transition them to Thrive Together if they'd like to go there.
I was going to say, particular for online, we usually just have organizations that we have known have worked with our patients, and we've actually maybe have gone and had educational courses with. So one of the organizations that come to mind is Red Door Community. And like I said before, Cancer Care, those are organizations that our patients frequently use and we are in frequent communication with. Sometimes we even had staff that used to work there actually work at NYU. So we kind of go from there and collaborate with them.
Well, thank you for that question. If there's ever a saying that you leave the hardest for last, then this definitely qualifies. It is a very important question. GLP-1 agonists are some of the most rapidly growing in use in terms of class of medications. And you bring up a very good point, which is that, you know, there is a risk of pancreatitis or pancreatitis risk associated with these medications. And the truth is we don't have enough data to know what the risk of, certainly not of pancreatic cancer, but even of pancreatitis is in a patient who's not affected by, or who does not have a prior history of pancreatitis. In my own practice, and I'm gonna open this up to all of our faculty, who have different expertise in this, but at least in my practice, I tell patients that in the absence of data, when you do not have a documented history of prior pancreatitis without a clear inciting factor that has been removed. So if somebody had a gallstone pancreatitis attack that has resolved and no longer gets pancreatitis, and this was several years ago, I think it probably is reasonable to challenge with GLP-1s. The data is even for that pretty slim. Outside of that, in terms of cancer risk, I don't think we know, and it comes up in my early detection practice very often of should you be on a GLP-1 agonist if you have a family history of pancreatic cancer or even a germline mutation with pancreatic cancer. And I think it's a risk benefit. These drugs are very beneficial for the management of obesity. There's no data to suggest that they accelerate cancer formation. But there are several people in the room who may or may not want to commit to additional answers. I'm turning to Dr. Shaheen Totier.
So we're studying pancreatitis on the research side, and we looked into this problem because we were interested if it's something to study in the laboratory. And it turns out the clinical evidence is so weak, it's almost non-existent. But it gets into every ad, as you point out. And there was a recent very high-profile paper which went through all the effects of the GLP peptides. And there's good evidence listed for everything else but pancreatitis. But suddenly the pancreatitis is listed as a significant risk without any data. So, and there's a new commentary coming out from David Whitcomb, who's one of the experts on pancreatitis. And he also maintains that simply as you put, data is scarce, but it's almost non-existent, just anecdotal. So I wouldn't be worried about this at this point.
Yeah, I mean, I have very little to add. I would just say to also just think about the bigger picture is that, you know, of course, this is focused on pancreatic cancer, but there's other competing issues such as fatty liver, which is becoming one of the most common reasons now for cirrhosis in the United States, metabolic syndrome. And so I think that the benefits of the GLP-1s far outweigh that small risk of pancreatitis. That's all.
I think the GLP agonists could be a nice lunchtime discussion. But I want to thank everybody. This panel is the reason why we're all here. It's to support families and patients who have pancreatic cancer, because it's not only the patients. So I want to thank you all for spending a Sunday morning with us to sort of build a community around treating this disease. I want to thank all our speakers, partners, and volunteers who made this day possible, including Caitlin, who worked tirelessly, and Trish on this. Your dedication reminds us how our work is so important. The fight against pancreatic cancer is a hard one, but together I think we can make a difference in the lives of our patients. Thanks again for being a part of today's event. And without further ado, lunch is served.